This is a video on the intra-aortic balloon pump. This is a device that's used to mitigate the adverse outcomes of cardiogenic shock. This device is relatively simple, it's cost-effective, and it's easy to implant by coronary catheterization directly into the vessels. There are a number of indications for the intra-aortic balloon pump. It can be used in congestive heart failure, and acute exacerbation with hypotension might require an intra-aortic balloon pump. And again, this is a relatively simple and cost-effective solution compared to other cardiac devices. The balloon pumps can also be used in prophylactic or adjunct treatment in high-risk PCIs. So if somebody's getting percutaneous coronary intervention for a stent, for instance, after a heart attack, they might do this ahead of time just to prevent damage or cardiogenic shock later on. It can be used in myocardial infarction with decreased left ventricular function leading to hypotension. It can be used in myocardial infarction with mechanical complications leading to cardiogenic shock. For instance, people might have acute mitral regurg due to papillary muscle rupture or ventricular septal rupture. That might indicate a balloon pump. It can be used in patients that have decreased cardiac output after coronary artery bypass grafting surgery. And it can also be used as a bridge to definitive treatment in people that have intractable angina, people that have myocardial ischemia, people that have refractory heart failure, or intractable ventricular arrhythmias. So all of these conditions might lead to a different device being used or a different implant, and this balloon pump can be a bridge to those more definitive treatments. That being said, there are a lot of uses for it, but that being said, there are also contraindications to placement. You don't want to use a balloon pump in patients that have moderate to severe aortic insufficiency. It is going to be sitting in the aorta, and you don't want to exacerbate or trigger anything regarding their aortic insufficiency. You don't want to use it in patients that have aortic disease. This can range from dissection to aneurysm, porcelain aorta, aortic trauma, and pseudoaneurysms of the aorta. Now these devices of course sit in the descending aorta here, and these conditions might disrupt how it sits, they might disrupt its position and its function. You also don't want to use balloon pumps in patients with severe peripheral vascular disease unless these patients have been pre-treated with stenting of those peripheral vessels. You don't want to use balloon pumps in severe aortic atherosclerotic plaques. Again, that can affect the position, placement, and function of the balloon pump. You don't want to use balloon pumps in patients that have uncontrolled sepsis or uncontrolled bleeding. Now the way it works can kind of be broken down into two sections: what happens during diastole and what happens during systole. The balloon pump senses early diastole. It does this by sensing the dicrotic notch, which remember signifies aortic valve closure. So when you have a pressure waveform from the arteries, from the systemic circulation, you have this first bump and then a dicrotic notch usually happens here. The balloon pump can sense that dicrotic notch and then immediately inflate. When the balloon inflates, it augments the aortic diastolic pressure. So that's this D wave here. This is the balloon inflating, increasing the pressure and augmenting the diastolic pressure and improving coronary perfusion. The balloon then deflates, and this is the systolic unloading of the left ventricle. This kind of creates a negative pressure in the aorta, and it essentially allows the blood to flow forward even better than if the balloon was not deflating or not there at all. So it deflates during systole to create a negative pressure and renders a lowered asystic aortic and diastolic pressure compared to an unassisted aorta. This combined effect during systole leads to increased myocardial oxygen supply and decreased myocardial oxygen demand. So augments diastolic pressure, and then the negative pressure during deflation augments the systole. The balloon pump waveform tracing is shown here, and we can walk through the important parts briefly. The balloon is inflated during this green segment here, and you can see how that increases that pressure to the D waveform, which we said was the diastolic pressure, the augmented diastolic pressure. The C here would be an example of unassisted systole. This is normal systole that was not impacted by that balloon deflating. D, we said, again, was the augmented diastolic pressure, which increases your coronary perfusion pressure. Remember that the coronary arteries are perfused during diastole, and if you have a large balloon that's inflated in the way, that diastole will allow more blood to go back into the heart to perfuse the coronary arteries. B here is an unassisted aortic and diastolic pressure. So if you're unassisted, you're just going to have a normal pressure return here If you are assisted during diastole, remember that assistance during diastole comes from the deflation of the balloon. You'll have an even lower pressure. That'll go even lower down to here. I hope this review of intra-aortic balloon pump was helpful, and thank you for listening.